Understanding dementia and delirium. Frontotemporal dementia. In this short presentation, you will learn what frontotemporal dementia is and the signs and symptoms of the different types of frontotemporal dementias. Frontotemporal dementia is a rarer form of dementia and usually affects people between the ages of 45 and 64, but can affect people younger and older. It predominantly affects behaviour and personality, with relatively few memory problems in the beginning. So this is something to bear in mind. Not all dementia creates memory difficulties early on. It's caused mainly by a loss of cells in the frontal and temporal lobes of the brain, and is characterised by either, again, a progressive change in personality and behaviour, or deterioration in language abilities. So frontotemporal dementia is divided into two types. We have what's called behavioural variant, or primary progressive aphasia, and this depends on where the damage is in the frontal lobe. So if we look at behavioural variant first of all, as it suggests, the person may struggle with problems in behaviour and personality. They may lose their inhibitions, so they may lose their filter and become increasingly extroverted, making inappropriate remarks to people, being rude or impatient. Personality may change dramatically in a person. Some people have been known to spend excessive amounts of money. They may go on to develop a sweet tooth and a preference for unusual types of foods. The person may hoard things, and overeating and excessive drinking of alcohol may occur. So this is very much more around behaviour and how the person's behaviour may change. The person may experience aggression, and they may have changes in their sexual behaviour, either becoming more or less, or inappropriately interested. Their behaviour may become more obsessive, especially about time. Some people often are watching clocks, their fixed routines, everything has to be done within a certain time. And what is really sad is people will go on to lose their empathy and awareness of others. So they may be totally unaware of what's going on around them and what other people may be experiencing. The person may become apathetic and withdraw from social activities as well, but also become more distracted more easily. And at later stages, the person may frequently put objects in their mouth. So this type of dementia is very much initially around the issues of behaviour and personality. When we look at a different type of frontotemporal dementia, we could look at what we call primary progressive aphasia. This is a group of frontotemporal dementias that cause a loss of speech and language. And again, it all depends on where the damage is in the brain as to how the person presents. So when we break this down, we look at primary. That means it's caused from within the brain. It's not an external cause. It's progressive, as with all dementias, so it worsens over time. And aphasia, this means a neurological language problem. This is something that affects a person's ability to communicate. Now, these types of dementias are divided into semantic dementia and progressive non-fluent aphasia. Long words, some of these, I know. So, when somebody has semantic dementia, they may have a loss of understanding what certain objects are for because they may not understand what the words are. They may lose their knowledge of what words mean, so they may not understand what you're saying to them. They'll often lose words, so they'll substitute words for others, and often hear people saying thing or thingamy. They'll have problems with reading and writing. And you may find they often talk about things in a roundabout way. And this is what we call confabulation. And a lot of people who have dementia do this over time. But in semantic dementia, this is something that we see early on. The person may have word-finding difficulties. And as I mentioned earlier, may have difficulty understanding what people are saying to them. In progressive non-fluent aphasia, again, this is a difficulty with language and communication, and the person may present as their speech being more effortful, struggling, really struggling to speech, to produce words. Also difficulty understanding other people. The structures of their sentences may be affected. They may miss out words and make mistakes in grammar. And words may come out more distorted. They may become more slow, hesitant, and disorganised. So it might be really difficult to understand what a person is trying to express to us. And this is where perhaps not listening to the words, but more to the emotions of what the person is expressing to us is important. So all of this is really due to difficulties in the coordination of the movements around our mouth of how we speak. This short presentation has helped you understand what frontotemporal dementia is and the signs and symptoms.